Let's begin with the next part of parasitology. There are going to be a set of 3 families that we have to talk about, and these include the cestodes, the trematodes, and the nematodes. Amongst the cestodes, first I'll tell you their names. Cestodes are also referred to as the tapeworms because they look like tapes, flat like tapes. Then the trematodes are said to be flukes because they look like a leaf, and the nematodes are said to be worms like roundworm, hookworm, and all of those. Please remember, out of these, the only one having a body cavity is the nematode. And if there is a body cavity, of course, there is also going to be an alimentary canal in it. The only one with a body cavity and alimentary canal. The others don't have a body cavity, don't have an alimentary canal. Also, which is the only one which is dioecious. Dioecious means that it is going to have male and female separate, is of course going to be the nematodes only, whereas the other ones are going to be hermaphrodites. Of course, there are some exceptions which I will tell you eventually, but broadly all of them are hermaphrodites. Only nematodes are male-female separate. So remember, everything is with the nematode. The body cavity, the alimentary canal, and the male-female separation. But who has the segmentation? Please note, the cestodes are the only ones which are going to be segmented. Rest all of them are non-segmented. So is your basic table okay with everyone, so that I can now move on to other definitions? Before I start with parasitology, I first want to give you all some definitions. For example, whom do you define as a definitive host? A definitive host is the one in whom the sexual reproduction happens. The male, female, gametocyte, or wherever the larva, the sexual reproduction happens, eggs are laid, that is going to be the definitive host. Whereas where all the asexual reproduction is going to happen, that is going to be the intermediate host. So let me tell you that in most of the cases in human beings, in most of the cases we are the definitive host, but there will be a list where I will tell you that man is an intermediate host, means in us only asexual reproduction will occur. So what is that? When we are an intermediate host, it is known as best top. That is a mnemonic that we have. What is best top? So B is going to be for Babesia. E is going to be the dog tapeworm, Echinococcus, because dog tapeworm hai, so we are not going to be the main people. We are going to be the intermediate one. Dog will be the definitive host. So B we have for Babesia, E we have for Echinococcus. S is going to stand for Sarcocystis, which we don't read too much, but you just have to know. Then we have T, and P. So TTP stands for, T stands for the very, very famous, the Toxoplasma. T for Taenia solium and Plasmodium. So repeating, Babesia, Echinococcus, Sarcocystis, Taenia solium. ये best हो गया. And top is going to be Toxo, TO for Toxoplasma and P for Plasmodium. So I think this is sorted, but right now it's more of ratta because you've not read all of these. When you read all of these, you will realize you don't need this mnemonic. I'll give you adequate life cycle mnemonics over there that you won't need all this story, right? Let's move forward. So definitive host is where sexual reproduction occurs. Intermediate is where asexual reproduction occurs. So now we move on to the next one, and what is a paratenic host? A paratenic, para always means someone on the side. So paratenic host is the one in whom the larval stage is going to survive. Right now, they're just definitions, just register little bit parts of it. So larval stage is going to survive. That is a paratenic host, means it is just going to survive, only survival, but there is no further development. There is no development that is going to occur. There is only transmission. That larva will only be given forward. That larva is not going to become advanced or developed. So remember, paratenic host is just one host on the side who is storing the larva and is going to give it further. No development is going to occur in it. Finally, who is the accidental or the dead-end host? I mean, I don't need a definition for this because accidental word tells me that it is going to be by an accident. Like for example, let me tell you that in Echinococcus granulosus, in Echinococcus, humans are the accidental host. Humans are the accidental or the dead-end host. Actually, we can be intermediate also, but we are actually the accidental or the dead-end hosts that by chance it comes into us. So that is something which is very important. I hope everyone's okay with these definitions because we are now moving forward to host ho gaya. Definitive, intermediate, paratenic, accidental. Now we come to vectors. Vectors are the things which are transferring it. So what is it? Pehle dekho, I can see a lot of words written. Propagative vector, cyclopropagative, cyclodevelopmental. I want you to learn something. Propagative vector is the vector. What is the next alphabet in whom replication will occur. So if replication of the organism is occurring in that flea or that louse or that tick, that is a propagative vector. Whereas if we are talking, so everywhere propagative word comes, matlab ma'am replication is happening. Wherever cyclo word comes, so remember cyclo के साथ D याद रखना, CD come together ना, CD come together. So over there development is also going to occur. So let me repeat guys, when I'm saying first वाला देखो, when I'm saying propagative, what is gonna occur? Replication or development? Of course, only replication will occur. Propagative में only replication will occur. There is no development going to occur, and that is what happens when we are talking about Yersinia. Yersinia is plague, na? Plague spreads by rats. You know that. So Yersinia में all these rat and rat flea, they are actually rat flea वाला जो vector है, that is actually gonna be a propagative vector. It is only gonna result in replication, not in development. Next we come to cyclopropagative. Matlab, you will say ma'am propagative word is there, this means replication is occurring. Cyclo word is there, this means development is also occurring. This is a combination. For example, all the blood organisms, plasmodium, matlab malaria and babesia. In malaria and babesia, who is the vector? You know na, especially in, tell me for malaria, this you already know, female Anopheles mosquito. So over there is replication also, there is development also, that is cyclo also and propagative also. Finally coming to the last, that is cyclo-developmental. So over here C, D is anyway come together. So over here only the development is going to occur. Only the development will occur, there will not be any replication. Examples are going to be many things related to filaria, and also we have the flagellase, that is Leishmania trypanosoma. So right now as I said, they are names, but thoda samajh aa raha hai, that is good enough. So repeating, propagative means replication, PR, replication will occur. Cyclopropagative means propagative matlab replication will occur. Cyclo means development will also occur. And cyclo-development means just development will occur. Easy to learn. Now before I proceed on to the main part, you need to know that whenever I will talk about any of these organisms, I will definitely talk about the stool samples. Now under these stool samples, please note that first thing is that you will do a microscopy. What will you do in microscopy? The first thing that you will be doing will be the very simple saline mount. You will look at the stool sample under a, mix it with normal saline. Another thing that you will be doing will be an iodine mount. And iodine mount mein kya hota hai? The thing is that the trophozoites, if at all the trophozoites have to be mobile, the trophozoites are immobilized. The trophozoites are immobilized, so that is why you will see all the motility and the moving around in saline mount. As soon as you put iodine, it is going to be immobilized. So remember, iodine mein, it is going to be immobilized. Moving on, coming to, if you say that ma'am, I have a stool sample or whichever sample I have, but the parasite is not too much, the oocysts or the whatever parasites, trophozoid cyst, whatever you're trying to see ma'am, that is not too much. So what does that mean? That basically means that we are dealing, or we will have to do some concentration techniques. When I say concentration techniques, either, what are the two ways? If my parasites are very less in number, what can I do? Either I can make that sample sediment, then it will become very concentrated. Or I can make the eggs float, either make them float or make them sediment. So what are the two techniques that we have? We have number one, the very famous flotation technique and sedimentation technique. So if I use saturated salt, some things will start floating. So saturated salt flotation technique hota hai. Whereas formal or formalin, if I use formal or formalin, that is going to be the formal ether sedimentation technique. I hope everyone's okay with this, because these were to do with your remaining general parasitology parts. Now I think we are ready to take on our journey towards the three types, and those are going to be the cestodes, the trematodes and the nematodes. So let's begin with what? The tapeworm, which are segmented. Those are the cestodes. So let's begin with the cestodes chapter. And as I've told you that cestodes are the ones which are going to be segmented. And if you zoom in, you can definitely see that yes, there are segments present and they're looking like a tape. So these are all the tapeworms. Now the entire organism and everyone is going to look like a tape, everyone is going to look segmented. So how shall I differentiate? I'm going to focus on the head end. I can see their names: Taenia solium, Sarginata, H. nana, H. diminuta, Diphyllobothrium latum and Echinococcus granulosus. If I look at their head end, in all of them I can see there are some round structures, right? All of them have round structures, and these are known as suckers. So all of them, for attachment, they have got 4 suckers. Which organism does not show you a sucker? So over here, if I write this again, this is one of the most important organisms that you have. Look at how I've written it. Diphyllobothrium latum. It is Diphyllobothrium latum, which basically means that it's going to look like phylum. It's going to look like a leaf. Yes, it is looking like a leaf. And secondly, it is di, means it's not going to have any suckers, round suckers. It's going to have two something else. It's going to have two grooves. You can see that one groove is in front, one must be at behind. So one groove is like this and one is at the back. So these are going to be two grooves which are available for attachment. There are no suckers which I see over here. I hope this is question 1. You've understood which is the only organism which will look like a leaf and will show you the presence of these different lines or these grooves. That's Diphyllobothrium latum. Okay, rest all of them have suckers. How do I differentiate between the rest? Now I'm going to look at their hooklets. So first and foremost, which are the ones which have hooklets and which don't? So I'm going to tell you that all the ones that have ta in their names, they are going to do tata bye-bye to the hooklets. Okay, they are not going to have any hooklets that are there. So wherever you see tata, you're going to do tata to the hooklets, no hooklets. So when I say Taenia solium, hooklets are there. Definitely there are 2 rows of hooklets. But when I say Taenia saginata, do tata to the hooklets. There are no hooklets seen. Then when I do H nana, there are hooklets. Of course there's hooklets. But when I do H diminuta, again I say tata to the hooklets, so there are no hooklets. Again, Diphyllobothrium latum. This anyway did not have any suckers and hooklets, and anyway this is also lata. Diphyllobothrium lata, so tata to the hooklets. This also does not have any hooklets. Echinococcus granulosus has hooklets. So simple. Solium has saginata, tata, nahi hai hooklets. H nana has H diminuta, nahi hai hooklets. Diphyllobothria lata, tata, nahi hai hooklets. Echinococcus granulosus has hooklets. So simple. Wherever you see tata, do tata to the hooklets. So saginata, diminuta and lata, they don't have hooklets. Easy to learn, I hope now. Now, one last thing. All of them have how many rows of hooklets? The ones who have, jinke paas tata nahi hai, the ones who have hooklets, 2 rows, 2 rows. Which is the only one which has a single row of hooklet, and that is H nana. So remember, there is going to be a single row of hooklets that is present. So I'm going to repeat all of this once again. If you feel that you are feeling a little lost, we are going to do a quick recap. Firstly, which are the ones which does not have any suckers only? Diphyllobothrium latum doesn't have any suckers. If it doesn't have any suckers, of course, it doesn't have any hooklets. What does it have? It has 2 grooves for attachment. Okay, next, which is the one that looks like a leaf? Diphylum looks like a leaf, of course. Now we are going to say, what are all of the others having? 4 suckers, 4 suckers. All of them have 4 suckers, and all of them obviously have hooklets also. Which are the ones which don't have hooklets? So saginata, no hooklets. Diminuta, no hooklets. And lata, no hooklets. Rest all of them are gonna definitely have hooklets. And guys, which of them has only a single row of hooklets? And that is going to be H nana, and that is what I want to tell you. Now I'm going to give you a life lesson. This H nana is very interesting. That life lesson will come in 5 minutes. Before that, how are we dividing it? Please note all these. Taenia saginata and solium. So Taenia, and H nana and D latum. They are the ones which are going to go into the intestine. Rest all of them are going to go to different other organs of my body. But remember, Taenia, saginata, solium. H nana, because that is the smallest. It's the smallest tapeworm that we have, whereas Diphyllobothrium latum, the name is only so long that it is going to have the longest tapeworm that we have. So simple, if they ask you a simple question, smallest is going to be H nana, and latum, Diphyllobothrium latum, that is going to be the longest tapeworm. So smallest ho gaya, longest ho gaya, Taenia. These are going to be in the intestine. Rest all of them are going to be other parts of our body. So now you would obviously want to know their hosts also. So for all the cases, man is going to be the definitive host. Definitive host in all of them is going to be the man. However, in one of them, that is Echinococcus. In Echinococcus, man is not the definitive host. Dog is the definitive host. That is the reason that we call it a dog tapeworm. We call it dog tapeworm because dog is the definitive host. Rest everywhere, man. Okay, all of them are going to require 2 hosts. However, H nana has only a single host, and that is human beings. And Diphyllobothrium latum has 3 hosts. Diphyllobothrium. So what did I realize? Now I'm going to tell you that story. H nana, what was its size? Sabse chota. It was the smallest tapeworm that we had. Sabse small size. How many rows of hooklets does it have? The least. It has the Single, just one row of hooklets. How many hosts does it have? The least, just one host. So I can now make a table about H Nana and give you the life lesson that I wanted to. H Nana, God has given everything nano. Everything nano has been given to H Nana. In terms of the size, it's the smallest. In terms of the host, it has got only one host. In terms of the hooklets, it has again got only a single row of hooklets. So imagine, look at his resources, small size, single row of hooklets, single host, सब कुछ कम है. But you know, with those single hooklets, it has made the most of it and become celebrity. It is the most common cystode infection that we are gonna have, and that is what I want all of you to be. The life lesson is that you have to be H Nana. You don't have to run after hundreds of resources. You have to work in limited resources, limited sources, and make the most of it and emerge as a winner. So your take-home message is that in life, learn to be H Nana. Very, very less things in life it has, but it's become a winner. Okay, coming to the next, Diphyllobothrium latum. It's such a long name. In terms of the length also, we said it is the longest one that we have. And now in terms of hosts also, we are saying it's got the maximum hosts. So I hope everyone's okay with this basic introduction, because I'm going to now teach you the eggs, and after that we go into every organism individually. So what is this egg? This is an egg which has a lid on top of it. Whenever you see an egg with a lid on top of it, that egg is known as an operculated egg. Okay, so that is known as an operculated egg, and you can see there is a lid on top. And where all do you see it? So I'll give you a mnemonic for all parasitology. I'll give you one mnemonic over here. Operculated eggs are seen in STDs. What are STDs? Dekho how I learned it. Mnemonic also you should learn, na? Lid. When do you need a lid? When you need some protection. And where do you need protection? You need protection against STDs. So please learn Spirometra. Spirometra, which is also a cystode, shows you operculated eggs. D. latum. D. latum is also going to show you operculated eggs. And the next chapter that we are going to study, that is the trematodes. All the trematodes are going to show you operculated eggs, but tiny little exception yaad kar lo abhi ke liye, and that is schistosoma. All trematodes except schistosoma. So what is STD? S for Spirometra, D for D. latum, all from this family, cystodes, and T is for the next family, that is trematodes. So protection against STD, protection with the lid, that is an operculated egg. What is this egg? And I've got you a lot of labelings over here. So let's start with all these labelings one by one. Dekho, this is an egg. If I zoom into it, I will count the hooklets. 1, 2, 3, 4, 5, 6. Very faintly you can see, but yeah, this is known as a hexacanth embryo. Because it has 6 hooklets in the egg, this is a hexacanth embryo. Is that okay? So you've understood the reason for it. And in the exam, please don't get confused. What am I teaching you over here is the egg. These are the hooklets of the egg. What I taught you earlier was the hooklet of the full worm, the head end of the worm, wo adult worm tha. Now what I'm teaching you is the hooklet that you have in the egg. So how many hooklets? All of them will have, all the cystodes will have. So how I have learnt it is, cis stands for 6, hai na? So cystodes have 6 hooklets wala egg, hexacanth egg. Then let me look at the other labelings. I can see there is one outer membrane over here. Yes, if there's an outer membrane, there has to be an inner membrane, obviously. And in between the two, can you see some dirty dot 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 kind of granules? These are referred to as the yolk granules. The dirty material is referred to as yolk granules. What else can you see if you zoom in? You will be able to see one knob over here and one knob over here. Yes, they are polar knobs. They have polar thickenings, and from those polar thickenings, some threads come out, polar filaments come out. So I will realize that this area, this gap is very, very busy. Between the outer and the inner membrane, firstly you have some dirty material called yolk granules. Then you have some knobs. Then you have filaments coming out of it. Very, very busy area this has. And inside you have how many hooklets? Cystodes mein you have 6 hooklets. Everyone's done the basics. Now shall we start off one by one with the organisms? The first one, look at the name, Diphyllobothrium latum, the lengthiest name. What all do you know about it till now? It is gonna be the longest. How many hosts it's gonna have? The maximum. It's gonna have 3 hosts. Does it have? See, diphylum. What I told you was it's gonna look like a leaf. Does it have any suckers? No. Everything you know now. There are no suckers. Does it have any hooklets? Nahi. Diphyllobothria lata, tata to the hooklets. It's not gonna have any hooklets also. What does it have? Why do you call it di? So finally, it has two grooves or bothria for attachment. Bothria means mouth. It has two grooves for attachment. So सब कुछ पता है ना? By now life becomes easy. And how many hosts did you tell me? You said it has 3 hosts. So why don't you tell me the host? So from today onwards, guys, instead of calling it Diphyllobothrium latum, please call it Diphyssobothrium latum, because now after that you will know that Diphyssobothrium latum has two fish. देखो human तो you will have to keep us man. Along with that fish you will have to keep two fish. तो कितना? Human and 2 fish. How many hosts? 3 hosts. So who's the definitive host? Of course that's gonna be us. And what is the first and the second intermediate host? 1 fish, second fish. So there's gonna be a main wala fish. And then there's going to be a chota wala fish. Chota wala fish is cyclops. So remember, if they give you human being with chota wala fish, that is cyclops, with big wala fish, that is fish. So if there's human fish, you know, oh, 2 fish, that is Diphyssobothrium latum. So because it has 3 hosts, it is also going to have 3 larvae. It is also going to have 3 larvae, and if you want to learn their names, L1, L2, L3 is safe side. But if you want to learn their names, you are going to basically number 1, call it alphabetically, chalo, CPP. So this is going to be number 1, Coracidium. Then procercoid, that is also can be skipped, but this L3 you have to learn. Plerocercoid larva. What is it about plerocercoid larva? Because that is the infective form. So simple. It has how many hosts? It has 3 hosts. How many larvae does it have? It has 3 larvae. And if I put L in front of it, L3, plerocercoid larva. Please learn this name. That is the infective form. So now if I show you the life cycle, you will not at all have a problem. You guys are very scared of life cycles, I know, but don't be. Pick up the host. Okay, I see a human being over here. Then I see there is a chota wala fish, and along with the chota wala fish, now there is a big fish. See, can you see that? There's a human being, a chota wala fish, and a big wala fish. If there's a human and 2 fish, it is Diphyllobothrium latum. Still, let us start going into the same. You can now start off with the beginning part. That what did we eat? So first you said that, ma'am, there comes a human being. This chota wala fish must have been cyclops, and this big wala fish that you're referring to must be fish. So basically what I'm eating is I'm eating fish. I'm eating some fish. Many fish lovers over here. I'm not here to scare you, but this is the kind of undercooked or raw fish that they are having. And which larva does it contain? Which is the form that is coming to us? It is the L3 or the plerocercoid larva. L3 or the plerocercoid larva that is going to come to us. Once it comes to us, we all know that what is this organism. You can see that leaf wala, so definitely it is Diphyllobothrium latum. But which part of the intestine is it going to? What is written? In the small intestine. Do I have to learn that, ma'am? Small intestine, yes. Remember, D latum tends to go not only in the small intestine, but it goes and attaches to the terminal ileum. Socho. What gets absorbed from the terminal ileum? Vitamin B12. But if Diphyllobothrium goes and attacks the terminal ileum, the B12 absorption is not gonna occur, and the patient is gonna suffer from megaloblastic anemia. Right? So repeating, this is a very famous path medicine micro integrated question. D latum goes and attacks the terminal ileum. Thus the patient has B12 deficiency. Okay, after that, what is it going to do? After that, of course, it's going to lay down eggs. Eggs will come out into the feces. You can see the egg has basically come out into the environment. Larva kaun sa banega? L1 larva, L2 larva, L3 larva. I already know 3 larvas are there. So when the egg came out, kya bana? The first larva. Do you remember the name of the first larva? Coracidia. Coracidia. Who engulfed the first larva? Who has eaten up the first larva? That chota wala fish eats it up. Cyclops. Cyclops has eaten it up. And Cyclops mein L1 changes to what? Cyclops mein L1 changes to L2. Fine, the chota wala fish will be eaten by whom? Chota wala fish is going to be eaten up by the big wala fish. And over there, the larva will change into what? It will change into L3. And then that L3 larva, who is going to eat the bada wala fish? I will eat the fish. So every time someone eats someone, one larva form changes. We passed eggs, it made L1. But when Cyclops ate it, it became L2. When bada wala fish ate it, it became L3. When L3 came into us, it became an adult. So simple, L1, L2, L3 and Diphyssobothrium latum. I'm going to call it Diphyssobothrium latum only. What are the clinical features? Like I told you, it's an intestinal infection. Terminal ileum mein ja raha hai. So of course, there's going to be abdominal pain with nausea. And I've told you an anemia. Bothriocephalus anemia. Oh my god, what a big name. Bothrio, because of diphyllobothrium latum. But don't I know it is a kind of a B12 deficiency anemia, megaloblastic anemia. So now, please note there is one parasite associated with iron deficiency anemia and there is one parasite associated with megaloblastic anemia. So with iron deficiency anemia, what I'll be teaching you right in the end in the nematodes is going to be the hookworm. And right now, D latum I have taught you. Lamba sa naam, diphyllobothrium for big megaloblastic anemia. Diphyllobothrium for megaloblastic anemia. Okay. Now tell me, how does the egg look like? You will say, ma'am, ab bar nahi karenge. We have done it once. All the eggs are gonna have that lid. So sometimes the lid will be open, sometimes lid will be closed. Confused nahi hona. Over here the lid is closed. So don't feel that, Arey ma'am, I could not see the lid. The lid, you will see an imaginary line in the center. So yes, there is definitely gonna be a lid. वो भी नहीं दिखा. By chance you say, ma'am, in the exam I could not zoom in, lid नहीं दिखा. Look at the other end, it will have a knob. So all of these operculated eggs will have a lid, and on the other end they're gonna have a knob, and that is how you're gonna identify. Remember what was the mnemonic for operculated eggs? Operculated eggs are STD, Spirometra, Trematodes, Diphyllobothrium latum. So the egg is in front of you. How are you going to treat this? Of course, the treatment of almost all is going to be praziquantel. Let's move forward. Diphyllobothrium done. Moving on to the next. Taenia saginata solium. Firstly, can you see both of them? This also has 4 suckers and this also has 4 suckers. All of them have 4 suckers. But out of Taenia saginata and solium, who will not have hooklets? So you will say saginata, mein ma'am, tata to the hooklets. There are not gonna be any hooklets that you are gonna see. There are no hooklets. I don't see anything on the top. Whereas in Taenia solium, can you see? In Taenia solium, how many rows of hooklets are there? 2 rows of hooklets are there. Now the stories become easy, na? So tata mein tata kar dena. There are no hooklets. Now, abhi the story is very simple. Now what I'm going to show you, you would want to run away and you will say, ma'am, we want to disown your lectures now. Because this is one of the most troublesome table which every second year student, every NEET PG, FMG aspirant comes to me with, that ma'am, what has happened in this table? Trust me, you don't have to learn it the way you are looking at it. Try to look at the way I will look at this table, and I promise this is going to be the easiest table. Ab isme kya karna? Look at the lengthy name. Taenia saginata. Saginata is lengthier, na? Solium is chota na. So anything numerical I ask you, how much number, everything in number will be more in the Taenia saginata. So if they ask you that in the worms, that's why I did not split it into multiple table, because you don't have to read it only like this. Chota chota padna hai. Please remember, they ask you who is lengthier. You can see 5 to 10 meters is saginata, solium is chota. So who is lengthier? Saginata is going to be lengthier. Okay, look at the head end. Who has a larger head? Saginata has a larger head. Who has a pigmented head? Saginata has a pigmented head. Who has a longer neck? Saginata has a longer egg. Who has more proglottids? 1000 to 2000, more in number? Saginata. Who is going to have a larger gravid segment? Saginata. Who is going to have more uterine branches? 15 to 30? Saginata. Who has a vagina? Again, Saginata. Who is going to have more follicles in the testes? Saginata. Is this a tough table? Because you don't have to learn the numbers. You just have to make sure that you know that everything in excess that is happening, be it the length or the size of the scolex, the neck ka size, proglottids ka, uterine branches, vagina ka size, presence or testicular follicles, everything is more in saginata. But you will say that, ma'am, if I have an MCQ and they say that pick up the most important, so proglottids and uterine branches, number nahi yaad karna. Just know that to differentiate between Taenia saginata versus Taenia solium, we always prefer to take up this number 1 proglottid wala story and this number 2 uterine branches wala story. This is something, but yeah, you know what is more. Saginata is always going to be more, right? Okay, this was about ठीक है, saginata में everything is gonna be more. Only one thing you have done tata 2, and that tata 2 that you have done is gonna be that there are no hooklets. Tata 2 the hooklets करा था, बाकी everything is gonna be more. Now let's come to the real deal. This was the bad table. Now let's come down to host. Host तो पता है ma'am, we already know. The definitive host of everything is gonna be humans, but the intermediate host is different, na? Taenia saginata, it has ta, so cata, cattle. Cattle is gonna be for Saginata and pigs are gonna be for Solium. ठीक है, cattle, Saginata and pigs are gonna be Solium. Okay, so I've understood. Now you'll say that every organism has two things. It has a larva and it has an egg. So what is the name of their larva? So देखो, cattle and all this, cattle, cows, this reminds me of bovine. Cattle, cows, bovine होता है ना? So remember Cestodes bovis, you will say, okay ma'am, bovis मतलब bovine. This is present in the cow. This is present in the cattle. This is present in the cow. This is not in me. इसके नाम में ही है. This is present in the cattle only. Whereas Cestodes cellulose, it has so many S's वाला sound. Cestodes cellulose, सब में this larva is present. It's going to be present in the pigs also. It's going to be present in the humans also. That's just ways of learning that I'm telling you. Otherwise, your mind goes into such a frenzy and you can never learn anything. So remember, Cestodes bovis will always remind you of cattle. ये only cattle में है. Only in cattle, not in man. Tinea solium, सब में. Solium, सब में. Cestodes cellulose, सब में. Pigs में भी, man may be. Okay, so now you will ask me that what is the disease that they will cause. So remember the larva over here in humans. I want to know what it causes in us. It only causes intestinal infection. It is only going to cause intestinal infection. But Tinea solium, सब कुछ, everything is सब कुछ. So not only will it cause an intestinal infection, but it will also cause cysticercosis. Guys, I'm sure you've heard of neurocysticercosis. So basically other organ involvements are also occurring. Why ma'am? ऐसा क्यों है? Both of them are tenias, both of them are causing intestinal infection. Why is this solium causing सब कुछ? Because solium का egg is also infective to us. The eggs that we will produce from these larvae and adults, these eggs are also infective to us. Whereas for Saginata, the eggs are not infective to us. So when the eggs are not infective, you will not have other organ involvements. When the eggs are going to be infective to us, that is when the organ involvement is going to occur. So please remember, for the other organs to be involved, why did I write organ with a big anda over there? For the other organs to be involved, I need an anda. That is, I need an egg. And the egg being infective to man, सब कुछ infective तो सिर्फ solium का हो सकता है. Everything. Now I'll tell you the सब कुछ story. This is going to have Cysticercosis cellulose. That is the larva which is present in some people. It is present in pig also. It is present in man also. It is going to cause intestinal disease also. It is going to cause cysticercosis in the organs also. Iska larva is also going to be infective to us. Iska egg is also going to be infective to us. सब कुछ yes करना when it comes to the disease of Tinea solium. So God balances na. When everything in numerical numbers was given more to Saginata, everything in disease etiology is given to solium. God has a way of balancing things out. So now it's time for a test. You can see 1, 2, 3, 4. Definitely this is a cystode because I can see 4 suckers on the head end. And now if I say, is this Tinea saginata or solium? Of course you will say, ma'am, saginata hota to tata to the hooklets. But I can definitely see hooklets over here. So this is not Tinea saginata. This is going to be Tinea solium. Sorted? Should we see the life cycle once? And now the life cycle is simple. So you have clubbed both the life cycles. There is a human being. If it's human being with cattle, you will call saginata. If it is human being with pig, you will call it solium. So both the life cycles are the same, only minor changes you will see. Saginata with cattle and Tinea solium is going to be with pigs. So now you will ask me that, fine ma'am, I can see the adult worms also. Let's see what am I going to consume. So either I have consumed undercooked meat from either of these animals. I have consumed undercooked meat from either of these animals. I am going to get this organism. It is going to develop into adult male, male female hoga, eggs banenge. Eggs you already know. If it is a cystode, how is the egg going to look like? How many hooklets hoga? To hexacanth egg banega. We know all of that story. Ma'am, with that hexacanth embryo or with that hexacanth egg, now it is going to come out in the environment. Who is going to eat all those infected things? Either the cattle will eat it or the pig will eat it. Right? And that will go and settle into the muscle of this pig or whatever, pig or cattle jo bhi hai, uske muscle mein jaake those oncospheres are going to develop. They are going to develop into cysticerci. Cysticerci means larva. Common sense, na? If the egg had come out, the egg ultimately has to come out into a larva form. And now tell me, if you are dealing with, say, Tinea saginata, cattle wala, so what is the name of the larva? Cysticercus cellulose or Cysticercus bovis? Ma'am, cattle ke sath bovis hoga. And if you're talking about Taenia solium, then what are you going to call it? Sab kuch. So cellulose is going to be the name of the larva. And now that depends, what do we eat? Whether we get cattle or we eat pig, we are going to get the infection. So now, as I told you, there are two forms. Either there is intestinal or there is cysticercosis, all of the organisms. So now you know that intestinal to dono se hota hai. Taenia solium also causes it, Taenia saginata also causes it. So it is because of the larval form. That is what I was telling you. Larval forming, either it is Cysticercus bovis or it is going to be Cysticercus cellulose, right? Cysticercus cellulose. So what is the definitive host? Of course, man. Intermediate host depend karta hai. It can be pig also, it can be cattle also. So that depends. But when all this story I knew, ma'am. But when I'm talking about organs, different organs, ma'am, the organ is gonna be with O, so you have to take help of the anda. This is due to the egg, and the egg of whom? The egg of sab kuch, that is Taenia solium. And in that case, man is only the definitive host, man is only the intermediate host, man ही सब कुछ होगा. So please note that. Repeating it once again, when you're dealing with this cysticercosis, and I'm going to tell you different types of cysticercosis and how organs are affected, you will realize this organ involvement is happening only because of the anda, and this is happening only within man. This is not something happening in the animals. So now when I say cysticercosis, you will say, how, ma'am, it is happening only because of andas? Yes. So what will happen? The eggs go into the GI. I'll take you back to the life cycle. See, where did you see the adult worms? Can you see the adult worms over here in the small intestine? Imagine they laid down eggs. Where are eggs supposed to move out? Eggs are supposed to move out in the stool, but eggs decided we will penetrate into the GI tract. We will penetrate into the GI tract and then go to different organs, CNS, muscle, eye, so on. And if it goes to CNS, I call it neurocysticercosis. We all know that the most common site is going to be the brain parenchyma, and the most common presentation is seizures. Most common, but different segments of the brain can be affected. Na? Dekho, if it goes into the parenchyma, I agree with you that the patient is going to have seizures. If it goes into the ventricles, I think the patient is going to have hydrocephalus. Of course, it can go into the subarachnoid space. It can go into the spinal cord. So different properties are known. If it goes into subarachnoid space, matlab meninges mein chala gaya. So it can go to different parts of the brain, which I don't want you to learn. I just want you to learn that going into the parenchyma, that is why I said brain parenchyma, and causing seizures. This aspect is going to be the most common presentation. I hope everyone's understood how intestinal type and the neurocysticercosis type is going to be different. So now moving forward, how do you do the lab diagnosis? Of course, especially of intestinal, how are you going to do the lab diagnosis? You are going to do stool examination, because eggs mein to koi difference nahi hai, whether it is saginata, whether it is solium. All the eggs of the cystodes are going to look the same. They are going to have 6 hooklets. All the cystode eggs are going to be the 6 cystodes, so matlab 6 hexacan. They are going to look the same, right? And if you can't see the eggs, what are the concentration methods I taught you in the beginning of parasitology? There are formal ether sedimentation techniques that you can use. So ye to tha for the lab diagnosis of intestinal infection. But what do you do in the lab diagnosis of other situations? Cysticercosis, like for example neurocysticercosis hoga, ya fir neuro is just one organ, na? It can go into the muscle also, it can go into the eyes also, it can go into skin also. So there are so many different places it can go to. What are you going to do? You are going to do a biopsy. I'll share a very interesting case with you. So biopsy, you'll say, "Arey ma'am, pathology wala, pink and blue wala biopsy." Yes. So imagine someone comes to you with a skin nodule. How will cysticercus look under the biopsy? So I'll tell you a very interesting story from one of my residency, where a patient came to us with multiple nodules all over the body. And when a person comes to you with multiple nodules all over the body, and you are a first year resident like I was, I basically thought, oh, multiple chota nodules on the head, scalp, everywhere he had. I was just out of NEET PG preparation. I thought, oh my God, this I have diagnosed as a case of neurofibromatosis. So then I started asking him more history. I said, do you have some pigmented spots? Maybe I thought I was bubbling with knowledge, na? Because I was just out of my entrance exams. So I was like, oh, cafe ole spots dhoonte hain. Let me see whether he has he got ophthal examination done? Does he have leash nodules? I went deep down into neurofibromatosis. But one thing I was like, let me just find out, are these painful? I kept touching the nodules, palpating them, and he was comfortable. He said, no, there is no pain, but yeah, there are lots of nodules. पेनफुल नहीं था. अब न्यूरल ट्यूमर was not painful. I started doubting my diagnosis. I said, okay, let me just do what I have been told by my seniors. I was sent for FNSE. That day I was in the FNSE OPD. I said, okay, let me not put too much of mind into it. Let me put a needle. बाद में देखेंगे. When we put a needle, nothing came out. There was some fluid, white fluid came out. We couldn't see anything under the microscope. Then I told my senior said, let's get a biopsy done. Let's get one nodule removed and let's see under the microscope what is going to happen. And under the microscope, this is what we saw. We saw that there was an organism with a head like this, which had these suckers over here. You can see those round suckers. And it had an extremely convoluted spiral canal. And it had a thin wall around it. This is the classical, ye jo suckers with this extremely convoluted fold. This is a classical case of cysticercus. Remember, this is a classical cysticercus. Remember this head with this spiral tail. This is what we found on a biopsy. Other than that, you can do an X-ray. If you're thinking the nodule is in some soft tissue muscle plane, you can do an X-ray. You can also do a CT scan. Maybe the parasite will get calcified, and you can also do an ELISA testing. What is the treatment? As I said, treatment for all coming out to be praziquantel. So the two most important things, Taenia saginata and Solium, are done. Repeating once again that Taenia saginata, please remember the most important points I'm highlighting over here. Taenia saginata has tata to the hooklets. It's not going to have any hooklets, but the worm is going to have all the features. I'm just going to write all the features because you know everything is more over here, right? Whereas if you compare it with Taenia solium, solium ko God has given all the clinical acumen. Solium ka God says that when you're talking about the larva, that is Cysticercus cellulose, it is going to be present in humans also, it is going to be present in pig also. This larva is going to cause intestinal disease also, and yes, later on when it gives rise to eggs, those eggs are going to cause anda wala, that is other organ involvement also. So sab kuch is going to happen over here, right? Whereas in Taenia saginata, just intestinal infection, that's it. Okay, now although you feel these are the only two Taenias on this planet, no, there is something known as Taenia saginata asiatica and Taenia multiceps. One line about it. When I say Taenia saginata, you start saying, "Arey saginata matlab ma'am, there must be a human, and saginata means cattle." But if I add Asiatica word in front of it, that cattle is going to go away and the host is going to become a pig. Oh my God. This means Taenia saginata asiatica is having the life cycle very similar to Taenia solium. Bas itna sa yaad rakhna hai, nothing else. So please note, everything is going like Taenia saginata. But if I say Asiatica, only thing that I've done is that cattle nahi karna, then go the solium bit. Okay? The next one is known as Taenia multiceps. Taenia multiceps to bilkul hi weird hai. You will realize that humans are not there in their life cycle also. Human has become an accidental host. The primary life cycle is happening between dog and sheep. The life cycle is happening animal. Ye kiske jaisa lag raha hai? What I'm going to teach you next. This is sounding like the dog tapeworm. So, oh my God, this multiceps though has totally left the family only. Multiple direction mein chala gaya. Multiceps has gone in multifold direction. It is going to be having a life cycle between the dog and the sheep, just similar to Echinococcus, dog tapeworm. Human has become an accidental host. That is all that I wanted to know. So, Taenia saginata is like saginata, but if you add Asiatica, it starts looking like solium. Taenia multiceps though has gone in multiple other directions. It has started behaving like the dog tapeworm. So, why don't we study the dog tapeworm next? Guys, let's move on and study the dog tapeworm, that is Echinococcus granulosus. Come on, you know it. Isme there is no tata, nothing happening. So you know for a fact that over here there are 4 suckers and there are gonna be 2 rows of hooklets. Everything is going fine. But what was the exception? Why am I calling it dog? Because here the definitive host and intermediate host is not man. The concept of calling it dog was that man is going to be an accidental host by having some contaminated food or water. Man is going to be the accidental host because definitive host will definitely be the dog. That is why you call him dog tapeworm. And intermediate with sheep and other animals. So if you primarily see a life cycle, this is easiest to pick up. I'll tell you why. Look at the life cycle. Ma'am, primarily the life cycle is going between dog and sheep. Dog and sheep. Human तो बिल्कुल side पे accidental host है. So definitive host is gonna be the dog, intermediate host is gonna be the sheep, and by chance if we end up having some contaminated food and water by some eggs, if my contamination has occurred in the food and water with some eggs, that is gonna occur in a human involvement. But like I said, not only are we accidental, we are also dead ends. Not only are we accidental, we are also dead end hosts that we have. So let's have a look at the disease that it's causing, guys. This is going to result in the very, very famous hydatid cyst. What do you see over here? You have multiple pearly white cysts that are seen. Multiple pearly white cysts that are noted, right? So imagine if I see what is inside. Let me look at this cyst altogether. Iska kya layers hai, what is the composition? So if I look at, it's a very pearly white structure, right? What is inside all these? Multiple cysts are there. What is inside all this? It has a fluid which has a pH of little acidic, 6.7. It has certain salts, and this fluid is antigenic. This means if I puncture and I'll rupture this fluid, the fluid can cause anaphylaxis and death in a patient. Do you want to rupture it now after listening to this? Do you ever want to do an FNAC in this case? No, FNAC is contraindicated. Remember, the fluid which is little acidic, which is going to have little salts, but most important, it is antigenic. It is definitely going to cause anaphylaxis. Do not puncture this cyst. FNAC is contraindicated. So this you've understood. But now I want to ask you that if you just surgically remove it, puncture nahi kara, surgically pura remove kara, if you look at this under the microscope, how is it going to look like then? What are the layers of hydatid cyst that you notice? What are the layers of hydatid cyst? So I see there are 3 layers: pericyst, ectocyst, endocyst. So first and foremost, pericyst is something which people have made. Pericyst is something which people have made. Matlab I have made. It is host derived. It is host derived. It is going to be nothing but inflammatory cells. Tell me, if a parasite comes into your body, you will make some neutrophils, monocytes, macrophages. You will make some inflammatory cells, na? So this entire inflammatory cell layer, where you're seeing all the normal part of the maybe liver mein hua ya lung mein hua ya jahan bhi hua, over there, plus all these inflammation, eosinophils, neutrophils, whatever inflammation is there, that becomes the pericyst. Okay? Then this to you'll say, this is ma'am, this is to hamara contribution. What is parasite making? Parasite has ectocyst and endocyst. Ectocyst on outside, endocyst on inside. So what is the next layer? The next layer is ectocyst. What is it looking like? It's looking like a pink color line. Ectocyst shows you the famous paintbrush appearance. Very, very, very famous question. Ectocyst shows you the paintbrush appearance. And what do you see inside? Ma'am, finally inside I'm seeing all the organisms. These are the hydatid cyst wala organisms. So instead of just calling them organisms, they call it brood capsules. So when they use this very, very big term called, oh, brood capsules, kuch nahi ho raha, germination, new organisms are being made. So I'll write it in simple words. It is the organisms, or you can say, is this the germinal layer? Is this the germinal layer? Because all the organisms are forming over here. And finally, you'll say from outside to inside, if I have to go, outer layer is pericyst, which people have made host derived. Then ectocyst is going to look like a pink color paintbrush appearance. And endocyst is where all the brood capsules are formed. So what is there in the fluid? In the fluid, you see these hooklets, because obviously Echinococcus has hooklets, na? So you will see these hooklets also that are present. So please note, and if you go back to your general microbiology, I have taught you that hooklets of hydatid are Zn stain positive. So now tell me, guys, that once you have read all of this, you have analyzed that, okay, they are pearly white, their fluid is very, very dangerous, you've done the layers, tell me the organs. What is the most common site? The most common site, as we have been reading over here, is going to be the liver, and is usually the right side of the liver. Right side of the liver, in which it obviously means that the patient is going to have hepatomegaly. The patient is going to have hepatomegaly, and in severe cases, it can complicate as portal hypertension. Okay? Second most common site is going to be the lungs. Lungs means that the patient is going to have cough, and there's going to be sputum, there could be chest pain. These are the different things that lung involvement happens. So kind of expected. Liver involvement hoga, so there's always hepatomegaly. Lung involvement always cough. So remember, most common site is the liver, and the second most common site is going to be the lungs. Then after that, to any other organ of the body can be affected. There is no end to that. But moving forward, this was all about the features. How do you do the diagnosis? Remember, you can do imaging. I think everyone knows that very famous radiology sign that is known as the water lily sign, that is so shown by hydatid cyst. So hydatid cyst shows you the water lily sign. Do you want to do the cyst fluid examination? Usually, will you want to do an FSGC? Not at all. It is contraindicated. But if you see a cyst fluid, what will you see? I already know. I'm going to see the presence of hooklets, and we have already studied that the hooklets are acid fast, Zn stain positive. These are the two tests where they ask you a lot of questions. एक टेस्ट है पुराना वाला टेस्ट, जैसे स्किन के लिए you have Montus ना, skin test. TB के लिए है ना, TB के लिए you have Montus. For this also they used to have a skin test called Cassoni test. No one does it now. It is totally obsolete. So just know Cassoni test. You know why? Because in Cassoni test, they used to actually inject a little bit of fluid. And since that time, I have been shouting, cyst fluid is very dangerous. Cyst fluid causes anaphylaxis. So imagine if I inject cyst fluid into someone, that person might die only. They said, oh, this is a very dangerous test. Ye wo type 1 hypersensitivity, anaphylaxis wala test hai. Please remove this. Don't do this. No one does it now. Now what is done is ARC5 immunoelectrophoresis. That is the newer test. So one old test question comes, one new test question comes. Old test mein Cassoni test, no one does it. Risk of anaphylaxis, very, very deadly. I don't want to get into it. New test is ARC5 immunoelectrophoresis. Now you will say that, ma'am, FNSC to kar nahi sakte. How are you going to treat this patient? There is a technique called pair. The first P will be a little worrisome. You know what we do in pair? We puncture the cyst. You will say, ma'am, since then you were only shouting, don't puncture, cyst is very dangerous. Now you are only saying puncture the cyst. But yeah, as soon as you puncture, you take out all the fluid. You aspirate all the fluid. The fluid should not spill into the person's body. Then it will cause anaphylaxis. Immediately aspirate. So for example, if this is the liver and over here you have the hydatid cyst, first you're going to puncture and immediately you will take out all the fluid. You will aspirate it out. And you know after that what you'll do? You will give an injection. You will give an injection of 95% ethanol. Why? Because that is a scolicidal agent. It is gonna then kill the scolices, the brood capsules, the hydatids. It's gonna kill those. And once you have injected ethanol, you can't leave the ethanol there. Once all of them have died, you're gonna again re-aspirate it. You're gonna again re-aspirate it out. So I hope everyone's understood what is the pair technique. First you puncture, but don't worry, immediately take out all that dangerous fluid, aspirate it. Then you inject, give an injection of 95% ethanol, which means all the scolices and organism will be killed, and then you re-aspirate that fluid. Puncture, aspirate, injection, re-aspirate. That is what you do for dog tapeworm, Echinococcus granulosus. What am I going to do? Change one word over here, make it Echinococcus multilocularis. So you'll say, what is this multilocular thing? I'll say, hang on. Earlier, hydatid cyst was looking like a nice cyst like this. Multilocularis is inside every cyst there will be multiple cysts. Multiple locules are going to be there. So this is also known as the alveolar hydatid cyst. Now as soon as I say, oh, you know what I'll do? I'll tell you I would have also done that if I would have been in your place. As soon as I say Echinococcus multilocularis is alveolar hydatid cyst, students say, oh, this means the most common site must be the alveoli. No, here also the most common site is the liver and the second most common site is the lung, which was the case in your previous thing also. In the previous situation also, Echinococcus granulosus mein also, the most common was liver and second most common was lung. Here also I'm saying the same thing. Most common is liver, second most common is lung. Then why are we calling it alveolar hydatid cyst? Because the structure looks like alveoli. Multiple locules. That looks like an alveoli. That is why we are calling it the alveolar hydatid cyst. Okay, so do you want to see in dono ka life cycle? Because that I have not seen. So for example, now how is this life cycle going to be different? You'll say, ma'am, I can see human to isme bhi alag hai. Human to isme bhi accidental hai, fine. But this story has changed. Over here, you can still have the dog or the wolf, whatever. The story of the intermediate host has changed. Over here in multilocularis, you're going to have a chota sa rat. So now compare. See guys, if I go back to my hydatid cyst wala Echinococcus, we label it now. If I talk about Echinococcus granulosus, which was dog tapeworm, dog ya wolf, dono chalega. Dog ya wolf, dono chalega. But over here, you had to see a sheep. you had to see a sheep, whereas over here in Echinococcus multilocularis, I am seeing dog ya wolf chalega, but over here I am seeing a rat, and if I see a rodent, I know this is kuch problem hai. This is the Echinococcus multilocularis that is happening over here, the alveolar hydated cyst. Now, coming towards the end, the one who gave us life lessons, the one who is the smallest in size, the one who has only a single host, that is humans, and who has how many rows of hooklets? Only a single row of hooklets. So I told you the life lesson, na? Limited resources hai, but it has made the maximum out of it. This is the most common cystode infection. Do you know how is the life cycle going to look like? That I'll show you in a while exactly. But there is one cousin brother of this that I want to tell you. This is to H. nana, and we know everything about H. nana. H. nana is going to cause a lot of intestinal infection. ठीक है? There is a cousin brother of H. nana known as H. diminuta. See, now that is how microbiology is. If I would have thought of diminuta word, I would have felt this is the smallest organism. Diminuta, minute, but ऐसा नहीं है. I know that H. nana is the smallest, so they call H. nana as the dwarf tapeworm because H. nana is nano. That is how we've learnt it. H. nana is the nano car that we have, dwarf tapeworm, whereas H. diminuta is a rat tapeworm. Why rat? Because you will say, ma'am, ab compare karte hai. When I compare H. nana versus H. diminuta, firstly I need to know their names. This is a dwarf tapeworm. This is a rat tapeworm. इसमें एक ही host है, single host, human. Over here you've called it rat, so along with human there must be a rat also, na? That is why you've called it rat. So ho gaya different. Now you will say, how do their eggs look like? You will say H. nana looks like any other cystode egg. It's going to have the same. Let me show you that egg again. Do we all remember this egg that we did? How many hooklets will it have? It will have 6 hooklets. Will it have all these yolk granules? है ना? Yolk granules होगा. It will have those 2 polar knobs also. All of that, ma'am, that we have studied earlier, H. nana का तो वैसा ही चलेगा. Just like any other cystode egg it's going to be. But when I talk about H. diminuta, look at the egg in front of you. 1, 2, 3, 4, 5, 6. Hooklets तो same है. Outer membrane is there. Inner membrane is there. But what happened to all the mess in between? Do you see any yolk granules? No, the yolk granules are missing. Do you see any polar knobs? No, those are also missing. So the polar knobs and the yolk granules are missing, and that is H. diminuta ka egg. So basically whatever mess was happening over here, na, the yolk granules and polar knobs, wo chale gaye, that is H. diminuta, and that is how you will make a final differentiation between these two, which is very, very important for all of you to know. Please note, repeating, H. nana is nano, it is chota, it has one host. Diminuta sounds diminuta, but that is how microbiology is. What sounds is not the case. This is not chota, this is rat tapeworm, because with humans there is rat. Now if I show you the life cycle, things will become simple. If it would have only had a human, the life cycle is happening between human, you would have called it H. nana. But if I say with human there is a rat also involved, you would have called it H. diminuta. Sometimes in H. nana also a rat can come. Aisa bhi hota hai. But again, this is not something I would want you to know. The best is just think about how there's a life cycle in the human and how there's one in the environment. Human is going to be the H. nana ka life cycle. Okay, so now moving forward, what are the clinical features? Because I've understood it's an intestinal problem, but what are the clinical features? Like any other intestinal problem, abdominal pain, nausea, vomiting, maybe diarrhea, and like any other condition, the treatment is going to be with praziquantel. So nothing problematic over there. Going all the way back, guys, to the first slide which I taught you, which I hope now will make a lot of sense to you guys, because that time you might be feeling a little lost. Host revise karne jaldi. Tell me the host of H. nana, single host. H. diminuta, human and rat. Okay, Diphyllobothrium, Diphishobothrium. So human and two fish. Okay. Then we had Echinococcus dog tapeworm. So dog, sheep, human side pay, accidental. Taenia, solium and Saginata. Human to hai hi. Saginata is cattle and solium is gonna be the pig. So now you are ready maybe for some MCQs after so much of listening to me. So maybe you can start off by doing this one life cycle over here. Let's begin. Can you identify the life cycle? Best is, I see one animal here and human ko aisa kaise side pe, you have ignored. So there is a dog and there is a sheep. If there's a dog and the sheep, I know I'm talking about the very famous Echinococcus granulosus. This is the dog tapeworm, and human is going to be the accidental host. Very, very good. Let's pick pick up the next one. Identify the life cycle. I see a human being over here, and I see one big wala fish over here, and I see one chota wala fish over here, which is Cyclops. So if it is human to chota wala fish to big wala fish and back to human, so that is Diphysiobothrium latum. Life is becoming easier, isn't it? Coming to the next, which of the following is not a cystode? Wow, what a question. So D. latum is a cystode, Taenia saginata, Echinococcus granulosus. Schistosoma is not a cystode. I'm going to teach you in the next chapter. That's a trematode. So that's the answer over here. Next question, which of the following has grooves on its head for attachment? Doesn't have suckers, no suckers, but grooves. And remember, two grooves. Diphysiobothrium latum. Di means two. It has two grooves. Next, infective form of this Diphysiobothrium latum. So I had said it had 3 hosts and it had 3 larvae. And out of them, the L3 larva was plerocercoid. Plerocercoid larva was the infective form that you had. Next question. ARC-C5 counter immunoelectrophoresis on serum is a diagnostic test of, I told you again and again, this is the new wala test of hydated. Remember, I said for hydated one old wala test, Cassoni no one does, and this ARC-5 immunoelectrophoresis now is being done. That is done for hydated. Coming to one last question. Larval form of which of the following cystodes is not seen in man? Not seen in man. So first and foremost, you will say that Echinococcus granulosus ka to dog tapeworm hai, usme to once it comes into us, what can I say? Now the egg is going to come into us. When I say I have Taenias that are mentioned, Taenia saginata, Taenia solium, Taenia multiceps. So did I tell you that Taenia solium was sab kuch. The larva was seen in the animal also, in the human also. Taenia solium was sab kuch. But I told you Taenia saginata. Taenia saginata is something which is definitely limited only to larva. Batao, tell me the name of the larva. Saginata, ma'am, this was cattle. Cattle matlab this was Cysticercus bovis, and this was only present in the cattle. This was not seen in man. So that is the answer over here. And yes, with that we wrap up the entire discussion of the cystode chapter. Tapeworms are done.